So I want to understand what exactly is plastic surgery and why is it even called as plastic?
A lot of my patients in the last 10 years have come and asked me, are you going to put something plastic there?
Why do you think there is a lack of awareness here?
There are two main reasons. One is the emotional burden. The second reason is the financial burden.
Because of all this social media buzz, plastic surgery is often just thought from the aesthetic or cosmetic angle.
Social media is, people prefer to see something probably glamorous. They don't want to see something that don't want to ever happen to them.
How much capital does it take to set up like a plastic surgery center in Bangalore?
About 20 to 25 lakhs on infrastructure and keeping some capital in hand for certain machines that you need.
Thank you so much for giving us your time today and being on the Medifluence Show, Dr. Mayur.
Most welcome.
How are you?
Pleasure to be here.
Yes. So how are you feeling today?
It's good. I'm looking forward to this interactive session, and I want to probably it's a good idea to put off a lot of wrong conceptions that people have about the subject, and spread the message.
Yes. So let's get started then. So as a layman to me, right, I got to know about plastic surgery, to be honest, by watching Korean drama on Netflix. That was my first, what it is. And then, so I want to understand, what exactly is plastic surgery and why is it even called as plastic?
Yeah. So plastic surgery is actually called plastic surgery because it derived from the term plasticos, which means to sculpt or to shape. And the funny thing is that a lot of my patients in the last 10 years have come and asked me, are you going to put something plastic there?
Okay.
So that was the funniest thing I've heard, and I keep hearing that every time. But plastic surgery is basically derived from that, but it's so much more. It's a very wide field, a very specialized field.
So I think I have a fair bit of understanding that there are two segments in plastic surgery, right? One is more in the aesthetic cosmetic angle and the other is the reconstructive work that you do. So can you probably deep dive a little bit more about the reconstructive part of plastic surgery?
Yeah, so reconstruction is the bigger part of plastic surgery. It consists of basically reconstructing anything in the body from head to toe.
Okay.
So we don't restrict ourselves to a specific part of the body. It can be the skin, it can be the muscle, it can be the nerves, it can be the bones, anything in the body. So from the head, including the scalp, till the toe, that is replacing a toe, replacing your fingers, all these things. So basically, the thing about plastic surgery is that the initial fathers of plastic surgery, they decided that we need to find tissue, replace like with like. So basically use the person's own tissue to replace a lost tissue. So that's how it has grown up and specialized into so many subspecialties. So it includes burns, it includes trauma, it includes nerve injuries, like it can be anything to do with either tumors infiltrating into the nerves, or it can be even accident related. Cancer reconstruction, so breast cancers, we use tissues. So whenever women undergo quite debilitating mastectomies, we use their abdomen tissue itself to recreate it. So just like that, there are many other indications for plastic surgery. So basically, anything in any and every part of the body that is lost either because of cancer, because of burns, because of accidents, or any other cause, we can reconstruct it in plastic surgery, and both aesthetically as well as functionally.
Okay, sounds pretty interesting. I see. Like, I'm also curious here. So you said burns, right? Like, can it be can we get the previous version of our body parts before, like how it's gonna look?
So it's never possible to do what is naturally created by God or the whatever force it is, but it's only possible to recreate something that's close to it as much as possible cosmetically. But we look more at function when it comes to debilitating conditions like burns and accidents. So if somebody, for example, electrical burns is quite debilitating for the patient, They lose parts of their body also. So we can only get back to a certain extent. But yes, to the extent that he or she can live a normal life, perform their normal daily routine activities, and even more if there is a lot of commitment even from the patient's point of view.
So I think when you spoke about reconstructive, one thing that I can think of is breast reconstructive surgeries from cancer patients, right? So how does that process look like?
Yeah. So the awareness is less. So I'm glad you brought
Yes.
it up because it's something I really want to talk about. Even though I've been in only the leading hospitals in Bangalore, still the awareness even among the patients coming there is very less. So yes, most of the times, patients are only thinking about the cancer and they're not thinking about life after that. So when we think of breast cancer, if you go to any of these big institutes in the US or anything like Memorial Sloan Kettering or Stanford, these institutes make sure that a plastic surgeon has to see a breast cancer patient. Otherwise, your consultation is not complete because getting them back to their normal routine is also important. So what we do in breast cancer surgery is that we use some of the tissue based on what the oncosurgeon decides. So sometimes if the breast cancer is not very advanced, they would remove only a small part and then we use the tissue around to recreate the breast. Sometimes there is a large part of the breast, almost the whole breast that's removed. And many a times there are patients with genetic disorders, which they have markers called BRCA. Is basically breast and ovarian tumors, which is passes down from generation to generation. And if these patients come with BRCA positive genes, then they have to undergo a prophylactic mastectomy and ovarian removal, just like Angelina Jolie underwent. In those cases, we have to reconstruct both the breasts. So what we do is we use the abdomen tissue. Most of the times, the women are diagnosed at a later age after their pregnancies and all are done. So usually they have a lot of lax abdominal tissue. So we use that, we shape it into a breast, and with its blood supply, we connect it to the blood supply in the chest. And they have a very, very close to normal volume as well as the cosmetic appearance. But there are many options. We can use implants too. The problem is awareness, and the problem is telling your patient that this is available to you. So it's very important to spread that word, because I don't think breast cancer treatment is complete without the reconstruction part.
Why do you think there is a lack of awareness here? Because I see a lot of oncosurgeons talking about breast cancers in India, and I do believe there are a lot of surgeries
Yeah.
going up. But why isn't this side of the reconstructive part is not often spoken about?
There are two main reasons. One is the burden of the disease,
Mhm.
Emotional, and then the second reason is the financial burden. So emotional burden of the disease is the fact that you are the shock that you're diagnosed with cancer. So you are only thinking about how do I get rid of this. So unless your primary doctor tells you that yes, this is there, it's treatable. So that's always said. And I don't mean this as I'm not blaming anybody, but I feel that very few are saying that no, reconstruction can be done. That reconstruction is an option. So I believe it's a responsibility of the primary surgeon or the oncologist who sees you to say that. So because that counseling part probably may be missing, it may be because of many reasons. Probably there may be lack of availability of plastic surgeons in that center where you're working, or it may be financial issues. So these are the reasons why when patients think about, I have to undergo the removal of the cancer, then chemotherapy, then radiation, I think it's too much for me and I don't want this extra thing. It's all right. But when we tell them that this is not going to be a burden to you, this is actually going to help you get on with life. Because after the breast cancer treatment, everything is done. A year later, that's when it comes back to them that, okay, we have to wear specific, like they have to have a change in their routine. Whenever they're wearing bras, they have to wear fillers. They have to make modifications in the dress they wear every day, which is a daily routine. And so you're reminded every day that you had breast cancer. So these things are the reason why reconstruction has to be given as an option when you initially see a patient, and then it's up to them. They can decide, and there is an option to do it even later.
Okay.
But always the first time during the primary surgery, they get the best results there.
Is this a complicated surgery?
It is a little complex.
Okay.
It's called microsurgery. It depends on, like I said, depends on the how advanced the cancer is. So the cancer is very advanced. Like if the cancer is spread throughout the breast and it's a very aggressive one, then the oncosurgeon would advise a complete removal. So in that case, we use the tissue from the abdomen, the tissue that's very lax, and we take it with its blood supply. We reshape it into the mound of the breast, and we connect it to the blood vessels in the chest. So it's microsurgery. It takes about 4 to 6 hours more than the after the oncosurgery part is done. And but after all that, it has great results compared to anything else. But there are other options. We do swing tissues from the back, and we can recreate the breast from that also. The call is taken based on a lot of factors. One is if the presentation, if the lady comes in, the patient comes in only before her family has been planned, then I wouldn't want to touch the abdomen. So then I'll offer them something else. But there are so many options. There are so many options for them which we can do. So it's all about, it is complex, but when you have a plastic surgeon who's been doing it for a long time, your failure rates are very low. And usually when we do these, you have big teams working on the patient 24/7. So these are things help.
So when you're talking about this, right, what I could think of is because of all this social media buzz, plastic surgery is often just thought from the aesthetic or cosmetic angle.
Yep.
Even when you talked about a lot of things now, like I've rarely read about it or even heard about it, right? So
Yeah.
why do you think these reconstructive work is like not even shown out?
So I think it's mainly because it's an awareness issue. Reconstruction is scary. Social media is always, people prefer to see something probably glamorous or something meaningful that's associated with their life. They don't want to see something that they don't want to ever happen to them, like an accident, like cancer or burns, right? So it's not something that we need to promote in terms of um, where the images are gory, and these are not pleasant for people to see. But when the number of reconstructive surgeries that we do since I started, um, it's a high volume. It comes to all the hospitals without the hospitals needing to promote them, or even us needing to spread awareness on them. But there are certain things like this, like breast reconstruction is more of a cosmetic thing, right? So it's not like a person can't live without their breasts. If I had to say it, I know it sounds very crude, but it's not like they can't live without it. But it's more of a cosmetic thing. It's more of a thing of well-being. It's more of a thing of self-confidence, self-image. So it actually falls more towards a cosmetic thing. So, but other cancers like head and neck cancers, there are tumors of the jaw, the oral cavity, the tongue. So whenever they remove these, we reconstruct those too. We recreate those parts too. We take the bones from the leg with its blood supply, we reshape it into the jaw, connect it to the blood supply of the neck. All of these are happening because these people don't have an option. You can't say that, no, I'll live without my jaw. You can't say I'll live without my tongue. You have to eat, have to speak. So these are things that there is no option. You have to get these things done so that you have a normal life. It's more of survival. But breast cancer as such, yes, I can. The idea is for women especially, it's changing a lot. People are more aware now because of social media and because of these support groups that are around. People who are breast cancer survivors speak to these people and they tell them that, no, this is the way you need to go through it. So the awareness is improving. But still there is a big taboo to, I don't think even the relatives would say that, no, why do you want to undergo these things? You should just worry about the cancer. What is there? So they don't understand that it's the individual who has to decide. So that's the reason why not too many people speak about reconstructive part of plastic surgery, while the cosmetic part, which is very glamorous, is being spoken about a lot, but that's also being spoken about very wrongly. There's
Yep.
too many misconceptions about it.
I feel like the reconstructive part, especially with cancer, onco surgeons are like dominated over there.
Yeah. So the issue is that, like I said, the tumor removal, yes, is the most important part, but life after that is also important. So that has to be always talked about.
Understood. So, when you spoke about breast cancers, right? So, in that sense, you said this reconstructive part is more like a cosmetic side. So, does that get covered by insurance, or like how does that work?
Yes. So since it's a cancer-related problem, the reconstructive part is covered by by insurance. But if in case a patient is getting the procedure done secondarily, so that's after the um, tumor has been treated and the chemotherapy and radiation is done, sometimes they do face issues. But bigger hospitals which do it very regularly don't have issues with that. But they may sometimes the companies may say that this looks more like a cosmetic part and not a rehabilitative part. So that's why in terms of insurance it is covered, but primary breast reconstruction is covered more so than secondary.
Got it. So, can you just elaborate on the insurance part, right? I know there are a lot of restrictions in the plastic surgery space. Like, what are the procedures that are covered under insurance and what are not covered?
Anything reconstructive, anything to do with disease which is curative is covered by insurance. But anything to do with cosmesis is not. But there is a big gray zone here, which I think people have to understand, whoever the authorities who are involved. That cosmetic surgery, there's a large part of it that is causing problems to the patients. For example, breast reduction surgery. It's because the patient has heavy breasts, which is causing neck issues, back issues, lot of lifestyle issues. It's not lifestyle as such. It's basically the kind of clothes you wear. But majority of them come with neck and back pain. So when you're talking about these, you can't say that this is cosmetic. You have to see where it's functionally an issue, because there are a lot of spine surgeons who tell me that they will benefit from a breast reduction. So at that point, that falls in the gray zone. Same thing with rhinoplasty. There are breathing issues with that. So if you say that, no, I'm doing a rhinoplasty only for cosmesis, no, that's not true. If obviously, because there's a severely deviated nose, there is breathing issue. Obviously, when I straighten it, I'm going to improve the appearance. So it's a functional rhinoplasty. So these gray zones are always some things where we can't say whether the patient will get insurance or not. But hopefully things will change, because we don't have something like the UK where it has the NHS, where everything is covered. So that's where there is a financial burden for the patient. But reconstructive is always covered.
Understood. I think now I also have a fat bit of understanding like what is covered. So moving on, I think with a lot of social media influences and these Gen Z influences coming in,
Yeah.
they're talking a lot about Botox and fillers, right? And I want to understand like what exactly are these injectables and what happens inside our body because of that.
Yeah. So, uh, so what we know is that with aging, there is a loss of volume in the face. So the bone becomes weaker, the fat becomes lesser, and everything sags down because of gravity. Everything that's holding it up, it loses support. So when we talk about fillers and Botox, it's all about, these are non-surgical procedures. These are basically, you come into the clinic, you get it done, and then you can go back home. Wherein whatever volume is lost, fillers are basically, they are made of hyaluronic acid. So basically it's synthetic, but it's a naturally occurring thing, compound in the body. So we fill that up and we fill up the areas of volume loss. And Botox is basically, you have these wrinkles that come up because of hyperactive muscles. This increases with age. So Botox helps to relax those muscles. Then same thing, there's something called as threads. So as everything goes down, you start seeing that your skin becomes loose, your face starts sagging down, and you get those jowls and all. So threads are something that help hitch up the skin and pull it up in position. These are all quick fixes for early signs. It doesn't work for people who have gone into advanced signs of aging, wherein there's a small thread is not going to lift up a whole heavy face. So awareness is good, and I see a lot of very young, population of both men and women coming in their teens, late teens, and early 20s, who come in for these procedures. Yeah, there is a trend that's moving there,
Yeah.
which is good in a way, but there is a downside to it. Yeah.
What do you mean by that?
So the downside is that awareness is good, but everyone's becoming an expert in this topic. So you see some people saying that there's no point going to dermatologist. I know this skincare, and then you do some reading. There's ChatGPT. You just read, and then you start learning these creams and all. But when it comes to Botox and fillers, as plastic surgeons and also as dermatologists, I speak for my good friend dermatologists also, who know the anatomy. We know where the muscle is. We know where the blood vessel is. We know where the nerves are. You can't just go to a salon, which is very rampant nowadays, and get a Botox or a filler done. You need to have either a dermatologist or a plastic surgeon who are well aware of these things to get it done. So I have a lot of patients who come in and say, I think I'll need Botox for this. I'll think. So the information is available, but there is a lot of misuse of that. It's important to understand it. For example, I can read that a car has this many cc's of, the capacity of the engine, the horsepower is this much. Okay, I know it. But can I design this engine? No, I can't. So that's something that you have to leave to the experts. So that's the line we need to draw when it comes to social media.
Yeah, I think when you said this, I feel like a lot of people are curious about it.
Yeah.
So they, instead of going to a plastic surgeon and dermatologist and making it like a formal consultation, they just want to know more from GPD, Google, and then like talk about it. I think it's a bit of an awareness stage, and people are not still like so much comfortable with that. But I think we are slowly moving up.
Yeah, we're getting there. We are, just like our economy is improving, even the awareness is improving. People will have to make mistakes to learn, and there is a lot of mismanagement happening. We as plastic surgeons are geared up to manage complications now, because we have a lot of people who are unqualified, who are doing these procedures, and they're backed by their councils also. They're saying that this is there in our syllabus. But I think as a patient, because we forget that this is still healthcare. It may be cosmetic, but it is still healthcare. You are still going to need a doctor to do this on you. So you won't go to a plastic surgeon for a cardiac surgery, right? Why would you go to? You wouldn't go to a dermatologist to get a dental procedure. Why would you? So it's very simple. Why don't you understand that, yes, these things have to be done by the specialists in that? And the biggest factor is cost. But if you do want to get a procedure done, I think we have done a lot of work on that, getting the procedure done right the first time. So it's important to choose the right person and go there and get it done, which is being, social media is kind of spreading the wrong message. Awareness is good, but there is a limit to that. It has to be the right information.
Yeah, I get what you mean.
Yeah.
So I think in social media I've seen this. So I know dermatology is a specialty, plastic surgery is a specialty, and there is another set like cosmetologist. Is this like a medically valid degree, or like what is that about?
No. There's nothing like cosmetology.
Okay.
There's nothing like a cosmetologist. These are these may be doctors, these may be post MBBS, these may be Ayurvedic doctors, they may be homeopathy doctors. I see a lot of dentists doing it.
Yep.
I have a very high regard for dentists for the work they do. I do facial fractures too, but I can't say that I can pull out a tooth. And I think if I learn a root canal, I can do it after 10 days, but it is not my specialty. So I feel that we should stick to our specialty. So a lot of these doctors are looking to do Botox and fillers just by doing a 5-day online workshop, or even a 1-month observership with somebody else. You will never be able to guarantee the safety of your patient.
Okay.
You will never be able to guarantee a result to the patient. But the problem with the public is that we look at costs first. And that's the current state that we are in. We are getting better, but everyone is only after the cost. But they don't understand that the first time you're going to do it for cheap the first time. The number of patients that come with loss of the lip after a filler, loss of skin over the nose after a filler, blindness after a filler.
Oh.
These are things that nobody can solve later on. It can happen to anyone, but it's not going to happen. I mean, the chances of it happening is the least in an expert's hand. And he or she will spot it early and can treat it. But a person who's not trained in this, who doesn't know the anatomy, how are you going to expect that person to do it? It's very important to do your research on who it is. So there's nothing like cosmetologists. Cosmetologist is just a field created by salons, by people who are not able to hire dermatologists or plastic surgeons. They want cheap labor, but they want the services to be provided. And we should not fall for that. There is nothing that is certified by any board, medical board, that says cosmetologist is a branch of medicine. It is not.
I'm actually like really surprised because I thought like cosmetologist, because I've seen a lot of doctor XYZ, whatever name it is. So they're putting up cosmetology in their Instagram bio. So I thought maybe it's like a fellowship after dermat or like plastic surgery.
No. So after plastic surgery and after dermatology, we do extensive training in addition to our degrees with experts or experienced dermatologists and plastic surgeons in these fields. For example, after I finished my plastic surgery, I did a 3-month visit in Dubai with one of the plastic surgeons there. I went and observed and performed fillers, Botox. I also visited another good friend of mine now who in Delhi, and I did watch him and assist him in surgeries. And this is after training for so many years. I am doing these further trainings so that I know that my patients are going to get the best, because we have to introspect in ourselves. Am I giving the right result to the patient? The same thing with dermatologists. They would visit, they would train, and then only you get these fellowships. Those are valid fellowships. After your MBBS or after your BDS or after your Ayurveda and homeopathy degrees, you can't do a 5-month course or a 5-day course. It's not even a 5-month course wherein you say, I'm a fellow of this. No, there's nothing like cosmetology. If you see cosmetologist, any dermatologist and plastic surgeon will proudly say that they are plastic surgeons or they're dermatologists on their Insta bio or their LinkedIn profile. They will never say we are cosmetologists.
Okay.
You see a cosmetologist, just swipe right or whatever it is,
I'm like really surprised I know, because I always thought like some sort of fellowship angle is there.
No, there's nothing like no.
Got it. So let's move on a little bit more to cosmetic side. I want to talk more about rhinoplasty, right? I feel like rhinoplasty is something that's picking up in India. Not a lot of procedures are openly talked about in India specifically, but this one particular procedure is sort of getting into the trend. Like, what exactly is rhinoplasty?
So rhinoplasty is basically changing the shape of your nose. I love rhinoplasty. I somehow have had this keen interest in rhinoplasty for a very long time. And the nose kind of forms the center of your face. So when you're talking to someone, the first thing you notice is their nose. And it kind of harmonizes every other feature. So rhinoplasty is basically changing the shape. There are two aspects to this. One is cosmetic and one is functional. So most of the times I have, in our Indian population, we have, especially South Indian population, we have broader noses, we have thicker skin and lips. We have a lot of times, most of us have breathing issues. And this is aggravated by allergies and all that. So most of the times patients come with a deviated nose or a big hump on the nose.
Okay.
Or it may be a very flat and a wide nose. These are things that we can change with rhinoplasties. And it's very important to know the structure of the nose to do that. So rhinoplasty is basically done for functional reasons when there are breathing issues, but most of the times it's combined. It is cosmetic, wherein the external appearance is changed, as well as functionally you do ensure that the airways are clear and the breathing is really effective and smooth.
How does this process look like? Like consultation and how many
Yeah.
the surgery, how many recovery, and all of
Yeah.
that I want to understand.
So rhinoplasty is, I always tell my patients, if you're coming for a rhinoplasty, you have to have 2 consultations with me, no matter what. Otherwise, I don't go ahead with surgery. The reason for this is because most of the people, like you said, social media. So everyone comes with this preconceived notion, and they show a celebrity's nose and they say, I want this. Most of the time, this is Janvi Kapoor. Before it used to be Angelina Jolie.
Okay.
So the first thing I say, I don't say it aloud, but I think to myself is the rest of your face like her? So why do you want that? You cannot put somebody else's nose on you. If you put Janvi Kapoor's nose on me, it will look so weird.
Yeah.
But I need to balance your nose to the rest of the face. So I put in thoughts in their head to tell them that this is how rhinoplasty is, and I ask them to come back. Write your doubts down and come back. And they will always have doubts. They will always have things that they haven't thought about, and then come back and clarify it. A rhinoplasty, as such, to your next question, takes about, it's a procedure under general anesthesia, and it takes about 2 days of hospital stay, and it takes about 7 to 10 days for recovery. There is some amount of discomfort during those 7 to 10 days, but then after 7 to 10 days is a complete relief, and you're back to your normal activities. You can do your normal activities even immediately, but you will have a splint around, you'll have a little swelling. So for you to be completely comfortable, 7 to 10 days.
So they wear a band-aid or something I've seen.
Yeah. So when we change the bony framework, there's a wide nose, we actually change the shape of the bone. So it's like creating fractures in a controlled manner and moving the bone. So we make it more slender. Actually, not just slender, it's according to the face. So to keep that in place, we need to put a splint. Just like you get a fracture in your arm, you put a cast. Just like we put a splint. That stays in position till the bone is kind of sticky and does not move from there. So that's usually about 7 to 10 days, sometimes 2 weeks.
Got it. So I want a bit more understand what are the other surgical procedures that we have when we think about face. Rhinoplasty is one.
Yeah.
If I could think of facelift, like what are the other things that we have?
So there's blepharoplasty. So every part of the face can be rejuvenated.
Okay.
So the first thing you notice when somebody is aging is the tired look that comes in. So basically the eyes kind of start narrowing down, the gap between the eyelids. That's because you're developing a lot of extra skin. Your eyebrows are kind of sagging down. And you also get something called as eye bags. This is fat which is underneath the eye which was retained in youth, which comes out. So these things are something we do a procedure called as blepharoplasty, wherein we remove that, we tighten the skin, we lift up the brow, and these are all through concealed incisions, nothing is seen. The other thing is something called as a facelift, like you said. So facelift is where, the excess loose skin that's sagging down, we pull it up, we tighten it through very small concealed incisions in the face. So you actually look almost similar to how you looked 20 years back. And similarly, we do that for the neck. And also, there are a lot of procedures wherein there's this volume loss. We can use the patient's own fat to make it into a more liquid form and inject it in the areas of the face so that it gives the volume back and everything. A lot of procedures.
Interesting.
Yeah.
I think I've some Korean drama that I watched. The hero gets a plastic surgery done. Like I think must be a facelift. I'm not that much aware of the scene, but after he goes again for I think a passport verification or something, and then it doesn't go through, and they feel like the face is changed. Like what is that? Does it is it real?
So I know that in rhinoplasty, it does change the look of a patient. So I had a patient recently who had a very deviated nose, a very crooked nose. And after I did the rhinoplasty, she had a pretty good result. She was very happy. But it changed her look. And her fiance did say that she looks very different in a good way. But it does change the look. So rhinoplasty, when there's a very severe deformity, yes, it does change the look of a patient. But so in the passport offices, you do need to give your discharge summaries, and sometimes you need to show those things to have undergone this procedure.
Interesting. So when you said like fiance, right? I have this question. Like I have read few questions in Reddit and Quora. Like my boyfriend or my fiance asked me to do this procedure, and you think I should talk to a plastic surgeon? Like, do you like really get questions like this?
Yeah. I just send them back.
Okay.
Or I tell them, just leave that guy or leave that girl. I don't think somebody telling you to get it done is a good enough reason for you to get cosmetic surgery. It is not. The first thing is that you are not getting it done for yourself. That's the most important. So you will not be happy with it. Second thing is that guy or girl may leave you the next day. So who are you doing it for? So I know it's on a lighter note, but you have to understand that cosmetic surgery is for you. So whenever a girl comes, forget with the fiance or boyfriend or girlfriend, or a guy comes with his girlfriend, even when a child comes, even a teenager comes with the parents, and the parents say, I want this to be done. I always ask the patient, do you want it done? And what do you want to be changed? Because finally, they are going to live their life with that. Nobody has to look in the mirror except them.
Yeah.
So it's important that you get that perspective, or you let them reach an age where they can take a decision. Never before that. So it has to be the patient asking me for themselves. If any time I get a clue that, no, this is somebody else speaking, they're speaking for someone else's opinion, I always say no.
Got it.
That's a red flag.
I think I've read a lot of questions like these when we work with plastic surgery, right? So when we do research and then I come up with all of these questions, I thought it maybe like somebody just over exaggerating or something.
Very common.
Okay, that sounds surprising,
Yeah.
but I get it. Yes. So moving on, I think there is a lot of taboo when it comes to breast, right? There are a lot of procedures, is what I recently understood about. Like, I want a little bit know more about the cosmetic angle related to the breast part.
Yeah. So the one part of the body that changes a lot other than the face is the breast as a woman ages.
Yep.
Especially after going through pregnancy, the weight fluctuations that happen with pregnancy. They gain 10 kilos, then they lose that, or they just continue to gain weight after that, because there's so much of hormones, there's so much of stress involved in that, and especially after multiple pregnancies. That they come to a point wherein they realize that the breast shape is completely changed. So it can be either completely deflated, as in there's no volume at all, or they're sagging down, and or they're large and heavy. So these are all the things that change, and most of them live with it, thinking that first of all is the fear of surgery. But no, I think it's more of no awareness being there that this can be changed, and it's not something that you have to live with. And the other thing is fear, that because nothing non-surgical can help with this.
Okay.
A lot of people who say we can use threads to pull up breasts, and we can use skin tightening devices. Each breast weighs about, supposing in an average female, it weighs about a kilo. A thread cannot hold a breast. It is just common sense. So it has to be surgical. Then it has to be about understanding what the problem is. So unless you understand whether it's loss of volume, whether it's ptotic, which means sagging breast, or it's a combination of both, or it's a large volume breast which you want to change. These are things that people have to know, that women have to know, that it can be changed. And there is no age limit for that.
I think there is a lot of taboo around it, right? People don't want to talk about breast openly, and like I want to understand, like there are, like as you said, 3 different or like 4 different procedures here itself, right? So what is this augmentation? What is this reduction? Are there more to it?
Yeah. So whenever there's loss of volume, we can replace that volume with implants.
Okay.
So the kind of implants available now is like the silicone of the medical grade of silicone is really good. That there are so many reels online that you can drive a car over it, a truck over it, and nothing will happen. And they never cause reactions in the body. So we can use implants to place it under the breast, and there are various techniques to do it based on what level you place it depends on the patient. You can place it under the muscle or under the breast itself, and that will give a volume back. The other thing is that when it sags down and the breast drops down, that is obviously just like the face, the skin becomes loose, even the breast, that's what happens to the breast too. Then we do something called as a breast lift, wherein we bring back the breast and the nipple to the normal position, which was there pre-pregnancy or in youth. There are a lot of times when the breasts are extremely heavy, and this can be because of hormonal issues, genetics, weight fluctuations, all these things, PCOD. So, in these cases, we can reduce the breast. So, we remove the tissue wherever required and reshape it to a normal or even better looking shape, a more natural looking shape. So these are so many procedures that you can do, and usually we do a combination. So, if a patient is having a low volume, that is a deflated breast, and it's sagging, we do a lift as well as we put an implant there to give the volume. We can also use the patient's own fat to volumize the breast. We inject it and get the volume back.
I think like all of this sounds interesting, but for a layman like me, like putting on an implant inside a body, like it sounds a little scary or even dangerous. Are these like 100% like safe?
Yeah. So implants are available of various grains,
Okay.
but at least I and most of the plastic surgeons use implants that are usually German or French made implants. There are Indian ones also coming, which are the silicone grade that's used is very cohesive and it's inert, which means that it will not react with the body's tissue. So it's very safe to put it in as long as the technique is right, and also you're choosing the right size. You can't say that I want a 500 cc implant when you have a very slim build. You can't use something like that. So it is a duty of the surgeon to say no. And so that's why the choice of implant, the choice of patient, the choice of technique, everything matters. An implant has a life. It has a life of 10 to 15 years, after which it has to be replaced, which is a simple process, as simple as putting in an implant in the first time. But it has to be replaced, and it's 10 to 15 years. So, because even you are aging over that 10 to 15 years, so your breast shape will change.
Yep.
Second thing is, the implant as such has only that life. It cannot be beyond that. So, it's very important to choose the right implant and to make sure that you're seeing your patient regularly, at least every 3 to 4 years, to make sure they're not having any issues. These are all important.
Is this like a day procedure or?
Yeah, a breast implant procedure is a daycare procedure. They can go home the same day. There are no drains, nothing. They're back to their normal activities immediately, the same day. And it's a simple procedure. By that, I'm not trying to simplify it. I'm saying it is something that has to be done only by plastic surgeons, nobody else. And because the position of the breast implant, the choice of the breast implant, and how the patient, what the patient requires, is decided on many criterias. And the surgery as such takes about 1 to 2 hours. That's all. It's under anesthesia, but they can go home the next day, and all they have to do is wear sports bras, a little tighter compression bras, and they're back to their normal activities.
Interesting. So, I think one particular procedure in plastic surgery that fascinated me the most is mommy makeover.
Yeah.
Because I have seen my own cousins feeling a little insecure about themselves after their pregnancy period, right? And all like even before this, there is I think a bit of depression that happens
Yeah.
after the kid is born.
Yeah.
So there is a lot of things in their lives as well, and a bit of insecurity angle sort of adds in to that. So I was very fascinated when I read about it for the first time, but I feel there is nobody actually talking about this in India. Like there is I feel there is zero awareness about it.
Yeah.
So I want you to talk about what exactly do we do in the mommy makeover procedure?
Yeah. So mommy makeover is not just one procedure. It's basically a makeover for the mommy, right? So it's everything that changes with pregnancy. There's a heavy fluctuation in the weight range that happens. 8 kilos probably is the minimum change that will happen in a pregnancy, and that goes on to up to 20 also. And then after that, the fetus, the baby that's inside, stretches out the abdomen. If it's a twin pregnancy, even more stretched out. If it's a multiple pregnancy, which means if it's the third or fourth or the second or the third pregnancy, the stretch has happened 2 or 3 times over whatever gap. So the muscles become weak. The weight gain and the weight loss has made the skin loose. Similarly with the breast, with breastfeeding, and then after that the gap between that and the next child, and then so the size of the breast increases, the size decreases, the weight of the patient increases, decreases. So all of this creates so many changes in the breast and the stomach that you will have a change in shape, and most of them start accepting it, but not with wearing loose clothes, by wearing loose clothes, loose jeans, or not even being able to wear those clothes. So mommy makeover is a series of these procedures. Like it starts from liposuction, removing excess fat.
What is liposuction exactly?
So liposuction is basically we use small incisions. Supposing you feel like there's fat in your arms or in the love handle area which you're just not able to lose. So we make small incisions of about 5 millimeters in that, and then we liquefy that fat with an ultrasound liposuction device, and then we suck it out. So it comes off as a liquid, and we're able to give that right shape to that part of the body. So which is the base, we create that hourglass shape for women, and for men we create a V, and for the arms and the thighs also we do that. So liposuction can be done in any part of the body, even the face and the neck. And that basically to remove fat.
It's not a weight loss procedure, or?
No, that's a very good question. So liposuction is not a weight loss procedure.
Okay.
It is a body contouring procedure. Even if I remove around 10 liters of fat from your body, you may lose only about 800 grams to 1 kilo. That's all, not more than that. But it gets the shape back to the body. So when you get that shape back, you will see it in the clothes you wear. So you get down by inches, but if you stand on the weighing scale, it's not going to show a change. So it's not a weight loss, it's a body contouring procedure.
Understood. So when it comes to mommy makeover, coming back to that, one is liposuction. Number 2 maybe the breast.
So breast.
Yep.
So breast, it can be augmentation, wherein you put an implant, or you just add fat, or both, or you lift the breast. So with sagging, you lift it up, or you may do a reduction, wherein the size is quite big, it's heavy, and you're reducing it to the size that the woman wants, based on whether it would suit her and whether it's realistic, the expectations. The third most important thing is the tummy tuck, which everyone talks about. And that what we do is, because of the pregnancy, the muscles get weak and separated out, the 6-pack muscles. It's called a divarication of the muscles. So we repair it, and we remove that excess skin that's there, and we plan it in such a way that the final stitch mark, which it lies within the innerwear. It's very close to the so low down in the abdomen that it's always hidden by the innerwear. And if we take care of it really well, then it's almost invisible. So that's how a tummy tuck works. Most of the times, it's a combination of procedures that happens in a mommy makeover, because I don't think that you should, if somebody is looking for a mommy makeover, they should be looking at an overall change. They can't say that, no, I just want my, they can, it's their personal choice. But if you do want something to fit well to you, or you want to get back to that shape, it's the whole body that has to change a little by little. It's not something to be extreme, it's transformative, but it does reverse all the changes that happens with pregnancy.
Does this affect if they want to get pregnant again?
Yes.
Okay.
So we do only tummy tucks. Breast reductions can affect lactation, so that we always explain to the patients. So they have to decide whether it's how important it is and how urgent it is. But a tummy tuck, we usually don't advise to mothers who have still not completed their family. So only if they say that, yes, we are sure we are not going to have any more children, or we have decided, yeah, this is, our family is planned and we are done, and I want to undergo this procedure, then only we advise for a tummy tuck procedure, or an abdominoplasty is what it's called. Otherwise, we stick to liposuctions for them. So liposuctions is where we can remove that excess fat, but we don't repair the muscles or remove extra skin, because again during pregnancy it's going to stretch out. So there's no point in doing it.
So when you talked about mommy makeover, right? You said it's a lot of like combination of a lot of procedures. So you do all of this at the same time?
We can do up to 2 procedures at a time.
Okay.
This depends on we need to assess the patient. So we need to make sure that the patient does not have any other comorbidities, which means like heart issues, diabetes, hypertension. Are they able to sustain a long procedure? Because a tummy tuck on an average takes about 3 to 4 hours. A breast lift or any of those breast procedures takes about 2 to 3 hours. So you take a combination of that, it's going to take about 7 hours to 9 hours to do a procedure. So when you're doing that, you need to make, and it's all under anesthesia.
Okay.
So you need to make sure that this patient is healthy enough for that. If they are, then I would, yes, advise them, yes, please go ahead, we can do it. Otherwise, we'll have to stage it. We do this first, then we do the next.
So how was the recovery if we do all of this together? So even if you don't do it together, you said 2 procedures at the same time, right? So do you perform like a week after, or like how is the process?
If it's one after the other, then you have to wait for a minimum of 3 to 6 months.
Okay.
Ideally, because you want them to completely recover and get the best result of that. Supposing I've done a tummy tuck first and I want to do the breast later, then I want them to have their swelling and everything completely resolved. And also I wanted to give them a good break from general anesthesia
Okay.
so that they've recovered completely and they're back to their routines. I would also prefer that they get back into an exercise routine that makes their results better in case of a tummy tuck, and then get them into breast surgery. So minimum I would say is about 3 months.
Okay, let's say I get a liposuction done today. So how long does it take for me to actually see the results from the surgery?
Yeah. So after removing the fat, the skin that was stretched out because of the fat has to now drape back into the new domain. So it takes about 3 to 6 months. That depends on a lot of things. First thing is the age. Second thing is how much weight fluctuation has the patient seen. So there's a patient who's had gone down from maybe 100 kilos down to 60 kilos. That's a huge weight loss. So the skin won't be that good in its tone and as well as its you know elasticity. So all of that depends on that. So we give them compression garments, which are basically tight stockings, like things about doing it for the arm. I give them stockings, and if it's for the torso, I give them a corset like thing, which basically keeps it compressed and helps the skin redrape back to the new structure that's created. It takes about 3 to 6 months. Compulsorily, I tell my patients 2 months they have to wear those compression garments. They have to get lymphatic massages so that everything drapes back and their result gets better. So but that's up to the patient how committed they are, and it's also important to start lifestyle changes immediately. All of this combined gives good results.
Got it. So I believe there is like not a lot of awareness with cosmetic and plastic surgery. Even if people want to get it done, I think the barrier is costing, right?
Yeah.
It's not covered under insurance completely. And I'm just gonna ask you openly, like how much does all of these procedures cost?
Yeah. So each procedure is different. Probably if you're looking at face rhinoplasty, it would cost you anywhere between 2.5 to 4 lakhs. All of this depends on the complexity of the rhinoplasty. If it's just something just for a tip change, then it actually may cost lesser. But if it's something for the whole nose, it's a bad deformity has to be changed, that would cost higher. This also depends on what kind of ward you choose. You want a private ward, you want a deluxe ward. All of that changes especially when we are working in corporate hospitals. Similarly, anything in a mommy makeover, each procedure costs about 3.5 to 4 lakhs. But that also depends on a lot of things like complexity as well as the kind of services you choose. That's basically from the hospital point of view. But these surgeries usually range between 2.5 to 4.5 lakhs. And also, if you do the combination of procedures, then it adds up. Small procedures like chin augmentation and all, you cost even lesser. So yeah, because these are not covered in insurance. None of these procedures are covered in insurance.
So in your practice, like month on month, what are the procedures that you do frequently in the aesthetic side?
So I do facelifts regularly. I do gynecomastia procedures regularly.
What is gynecomastia, if you could elaborate?
Yeah, so gynecomastia is something that's most men have this issue. It's like, I think it's every 6 in 10 men have gynecomastia of different grades. So basically, it's an abnormal enlargement of the chest. This is because of a hormonal change that happens to everyone. And there is some glandular tissue that forms just behind the nipples, and it varies from each individual. Maybe really small, which they don't even notice, or it may be quite large, which and almost feminine. It may look like a female breast itself. So gynecomastia is basically it's quite a debilitating, and I think it causes a lot of social issues also, because most of these men don't go bare chested, and they avoid beaches, they avoid swimming, they never wear tight tees even if they can. It causes a lot of changes in their lifestyle, and it troubles them from the teenage years. So most people say, you exercise, it's going to go. I've seen a lot of trainers who come with my patients to my consultations, and they say that no, this will go with training. But it's not true. You cannot lose glandular tissue by exercise. Yeah, and the fat in the chest is the last to go. So it's important to understand it first, what gynecomastia is.
Is it related to bodybuilding? I don't know. I'm just little curious
Yeah,
about.
that's so. Yes. So with bodybuilding, people who take anabolic steroids develop gynecomastia. They develop that gland, and I've had patients come in and they have to get it removed. Otherwise, the shape, especially ones who are competitive bodybuilders, they're not able to attain the shape of that chest because of that. And it's very hard glandular tissue. It's almost like stone, which has to be removed. It's because of abuse of anabolic steroids.
Understood.
Yeah.
So going back, you said one is gynecomastia, and what are the other?
Yeah, so rhinoplasty, gynecomastia, blepharoplasties I do quite commonly, and body contouring is quite common, along with tummy tucks. So among breast surgeries, reductions are more common in our population.
Okay.
Very few people want augmentations unless they are in showbiz, wherein they are getting into modeling, or they want to do something that's entertainment related. But reductions are very common. I do reductions very common. But my focus is mainly on breast and face. So I usually do these procedures more commonly than anything else. I do a lot of non-surgical work also, like fillers and Botox, which kind of is very rewarding in terms of not a very complicated procedure, but gives very great results, especially for people who are in the initial phases of aging and they're scared of surgery. You can give them in kind of a direction where surgery can take them. But fillers and Botox is something that I do also.
Interesting.
Yeah.
So if you could sum up and give probably someone in their late 20s or early 30s, like the anti-aging plan that they can plan for.
Yeah. I think when you're 20s, I think it's all about lifestyle. I don't think it's about getting into anything that's intervention. I think it's about maintaining a lifestyle, getting good hours of sleep, at least 8 to 10 hours of sleep, 8 hours at least,
Okay.
and a healthy diet, nutritious diet, not snacking, and the other thing is hydration. So these are the things that we have to take care. We live in an environment that's only getting worse and worse. It's easy for the generations before us to say that we didn't have these issues, but the environment has gotten worse. The water quality has gotten worse. The food we eat has gotten worse. The air we breathe has gotten worse. So we have to take care of these things by at least changing our lifestyle. The second thing is, yes, being aware. You may have a certain lifestyle which you're not able to change. For example, you have stressful work and you can't help but have less sleep. You can't help but sometimes miss meals. These are things which may make you age faster. In those cases, there are you have to be aware that there are certain things like Botox and fillers that will help. And there are certain things like skin regimes, which obviously I would suggest that you meet a dermatologist and speak to them and understand what's going on. And these are things that we can start off in your maybe early to mid 20s. And probably Botox and fillers, especially when it comes to rejuvenation of the face, especially when you're in your 30s, it helps a lot. This is what I would say, that find out and kind of understand what your skin is going through, when your face is going through. See whether you're able to make these lifestyle changes. Is the best way to do it is lifestyle changes. And then if you feel that no, I'm not able to cope up with it, then get help with these procedures like Botox, fillers and all, so that you can delay your aging. It's more of a preventative intervention.
I think it's much needed for us all to hear from you. So I sort of feel like there is an overlap between dermatology and plastic surgery, right? So when do I have to visit a dermat and when do I visit a plastic surgeon?
I think I will be stepping on a lot of toes when I say this, but I think there's nobody better than dermatologists when it comes to your skin and your hair. They undergo extensive training, and they study a lot about the skin, the hair, and the changes that happen with the skin, especially when sometimes you have actually some disease in the skin, which you're not able to point out. You may think it's, for example, dark circles. Now, it may be because of iron deficiency, it may be because of thyroid issues, it may be because of so many things. And if you're going to go to somebody who's not aware of these things, then you're not going to get this problem solved. So a dermatologist is a person who's extremely well, informed, and is very knowledgeable. He or she is very knowledgeable about skin and hair conditions. So that there is no doubt that they are your people to go to. When it comes to anything that is related to the aging part of it, there is an overlap there. So I feel that any dermatologist or any plastic surgeon who's trained in these fillers and Botox and thread lifts, the non-invasive ones, can do the procedure. But if you do need to figure out if this person is right for me, then you need to do your research. Speak to them, see their before afters, and then decide. I don't think anyone is better or anyone is worse than. But if it comes to anything surgical, there is no doubt about it. It has to be a plastic surgeon. I see a lot of people doing liposuctions without even knowing anything about what lies beneath the skin. And yes, it's easy to do it. You'll do it, you'll tell the patient, I give you the best result. The patient trusts you. But is it the best? And we, as plastic surgeons, we do general surgery first. We operate inside the abdomen. We operate on the liver. We operate on the pancreas. We operate on the spleen. We know everything that can get damaged. So that is why your best bet for anything that's permanent and that requires surgery, usually surgery is equivalent to a permanent solution when it comes to aging. I'm not saying that as a blanket statement. It's obviously when you are in that time of aging where it's a little bit, there's a lot of laxity and all, where threads and fillers and Botox will not help you. So when you're looking for a permanent solution, it's surgery. When you're looking for surgery, it's plastic surgeons.
Thanks for sharing. I think now I have a fair bit of understanding. Probably this would be the last question on the first segment that we would have. There are a lot of different procedures that you do, right? So I'm just curious, from a non-medico sitting out here, I want to know what a day in life of a plastic surgeon look like from morning to night.
Okay, if I talk about today is a Sunday, I woke up at 7. I went and operated on a lady who had put her fingers in a mixer grinder, and she had almost a complete amputation of her finger and of the 3 fingers. I put those back, and then I went and did my morning rounds. saw my patients. All were patients who I had done reconstructions for trauma. It was a lady who had a very severe injury of the leg. We took tissue from the thigh with its blood supply. We did a microsurgical reconstruction of a large defect on her leg. Then we had an oncosurgery patient who had the whole jaw removed, replaced with the bone from the leg. It's a fibula. It's called the fibula. And so we did rounds. So that's a Sunday. But on a regular day, my day starts at 7:30 in the morning, wherein I put the incision on the patient. So it can be children who have had maybe small trapdoor injuries, where the door cuts the finger. So usually it starts with that. Then it moves on to something a little more complex, which usually our surgeries last for about a minimum of 3 hours to a maximum of even 12 to 13 hours of standing and operating. In between, you have to give in some time to do some consults, speak to patients, speak to attenders who are a little distraught about the patients, calm them down, tell them everything is going well. And then again, when you come back out, there's a chance that you may have a trauma accident that comes in, and you get back into the operation theater. So typical day ends only at 7:30 if you're lucky.
Okay.
And then you get back home and put out the fires there.
Sounds pretty exhausting.
Very, very exhausting.
So how do you make sure, like, I think you do this every day, right? Almost on Sunday, even you have some procedures going on. So do you take breaks to make sure that you're always on your A game when it comes to surgery?
Uh, I do. So that's the thing which I probably miss out on. It is important. Yeah, it is important for us to take breaks. It's important for us to rejuvenate and come back. But yeah, I do take breaks. Um, Whenever I'm not operating, and if I'm so my the variety of my surgeries are very different. So I'll be seeing a patient who probably is born with a deformity, tense parents, correction of that, and then I see a cosmetic patient who is talking about changing in the shape of his or her nose, very particular about DC. So I have to be at different emotional levels where I am conveying to the parents that don't worry, your kid is going to be okay, to telling a patient probably that maybe you don't require this surgery, or yes, we can do something, and trying to it's two different extremes, cosmetic and reconstruction. So my consultations vary in emotion as well as importance probably, but I think both are equally important. For it's equally important for her to get her nose shape changed. It's equally important for that parent the kid's deformity is changed. So to calm myself down, I always listen to music in between. I'm always listening to music all the time when I'm walking up to my operation theater, or whether I'm sitting in my OPD in between patients. That calms me down, and probably patients do look at me and see, okay, this guy's always with his, but that's the only thing that relieves me and keeps my mind stable all the time.
I'm pretty surprised that it's the emotion part of it, right? Two different
Yeah.
perspective of patients.
Yeah.
I mean, this sounds like
Yeah,
really.
both are important.
Yeah.
So this is a patient who's, yes, these are parents who are worried about their kid, and it has either a cleft lip, or it has an extra thumb, or something like that. We also do hand surgeries, right? We are experts in hand surgery. So sometimes kids are born with all fingers joined together, sometimes with extra digits. They are in a different level of um, insecurity, emotional, mental. What something I have done wrong. They have, they put it on themselves. So to tell them that nothing's going to happen, and tell them that don't worry about the costs, we'll take care of it, everything will be fine. So people may think that no, that's more important than this, but this is a person who is not able to live their life daily because of the shape of their nose, very underconfident, they don't go out in public, maybe don't attend social events because of the shape of their nose, all those things. So you can't say that is more important than this. Both are social issues, everything is important to that individual. So you need to be non-judgmental in my field. You need to give everyone the importance they deserve and the priority that they deserve. So to that fluctuation, it's always important to be balanced yourself.
Got it. I think all I can say now is thanks for doing the work that you do for our society.
Yes.
So coming on to the second segment, just a couple of questions before we wrap up. So There are like few questions that upcoming plastic surgeons wanted to ask you. One particular question is, how much capital does it take to set up like a plastic surgery center in Bangalore?
That's a very tough question. In Bangalore, a plastic surgery center, it depends on what you want to achieve from that center. You want to be completely independent, as in you want to do the whole spectrum of procedures, even operative. For that, you need an operation theater also. When you need an operation theater, you just don't need an operation theater. You need everything that's required to support that. That goes from sterilizing rooms to preoperative rooms to a fire exit to have a stretcher elevator. All of that has to be in your infrastructure. And you need to have basically the airways. You need to have a single flow airway system and everything installed in that. Because see, if you want to do things, do them right. I believe that if you want to tell your patient that I'm giving you a safe and a perfect environment, you need to get it right the right way. So that's why I work only in the corporate hospitals where all of this is there. If you look at that and compare it to smaller centers, there will be some places where they skip certain steps. It's important to make sure that if we start from the basics, you should have basically a good ambience. If you're looking at plastic surgery, whether you're having cosmetic surgery as your main source, a place where you want to specialize, or you want everything in plastic surgery, the ambience has to be good. A well-lit, spacious place. It doesn't have to be enormous like many of the centers that are there in Bangalore. But you need to have a reception, a consultation room, a procedure room minimum. And you need to make sure that you have staff who are trained in this, qualified to do it, not just anybody doing it. And if you do want to do surgeries, then you need to have an operation theater. You need to have a high dependency unit, ideally. If you want, you have to have a lot of licensings done by the Private Medical Establishments Act, by all these people to get clearance that you are a safe center to perform. Because if you don't, then if anything goes wrong, God forbid, you are legally definitely implicated in this. And when you have an operation theater, if you don't have a high dependency unit with a ventilator backup or a intensivist to support in case there are complications, because let's not be mistaken, surgery is like driving on the road. You wear your seat belts. You can't say that, no, I'm not going to get into an accident. But you can say that if I get into an accident, I have the least chance of something happening to me, or I've taken all the precautions that I've taken. I have seat belts, I have my airbags in my car. Now, there's nothing else I can do. So surgery is just like that. If you have a center that has everything, you can still have a complication in the surgery, but you can take care of it. So either you have that in your center, that you have an ICU or you have an intensivist there, or you need to have a understanding with the hospital close by that if there's something goes wrong, we need your ambulance to come in and take. So you need to have an MOU with them. These are very important. So when you're building a center, first thing, decide how complex do I want my work to be over here. It's always easy to attach to closer hospitals, good hospitals. Take your operative cases there and operate.
So I think I want a bit more understand. Like you said, when it comes to like getting an OT, there is a lot of complications. So let's say without OT, how much does the center cost? Like an approximate number. And with OT, like how much does it cost?
So sorry, it depends on the area. It depends on which area you're.
Let's say central bank.
So central Bangalore, you will probably look at spending for a rented place. You need at least 1,500 to 1,600 square feet of area. You would be spending at least maybe 1.5 to 2 lakhs in rent every month. And your investments towards the clinic should always be staggered. I would say start slow. Don't start with a bang. Research the market. So you would want to spend about 20 to 25 lakhs on infrastructure and keeping some capital in hand for certain machines that you need. If you are going to jump into little more advanced equipment like lasers and everything, then you need to keep more. So supposing you're going to keep the minimum laser devices like a CO2 laser or a laser hair removal device, obviously it's with a dermatologist with you, not as plastic surgeons. But these are all things that you should have as plastic surgeons around you, because that completes your treatment. Then if you feel that, no, I just want to stick strictly to plastic surgery only, and then you need to keep about 20 to 25 lakhs as your investment, as your capital, to make sure you have a good center, and keep some amount in, because you're not going to start immediately. You will have a dull period initially. So you need to keep some capital for you to keep you, keep the lamp burning. Yeah. So that's I think at 20 to 25 lakhs is okay. But if you feel you have capital, you have support, then go big, make it well. Spend more on marketing and making yourself visible. If you're going to sit, yes, word of mouth will spread and you will definitely get better. That's the strongest way of marketing, is word of mouth. But if you want to go quicker, keep capital for marketing and make sure that you spend that regularly. Keep reassessing how it's going, and then that's how you're going to build your practice.
A follow-up question on that is, I think marketing is getting a little mainstream when it comes to these dermat and plastic surgery in the healthcare space. So I want to understand your perspective on like how important it is and how much time and budget do you think we can allocate into it?
I'm still I'm still looking for the answer to that, but I do see change in. I think it's the current generations, as well as, if you, it's not just the current generation. Most of the time, if you see even your grandmother sitting on Facebook and Instagram and watching these reels. So it's important for you to be there online. It's important for you to figure somewhere in terms of, yes, he's the guy who does this procedure, or she's the person who does this. Um, so it's very important to figure in everyone's daily life, because today it's possible. Now, everyone says, yes, word of mouth was the way we did it. But that's because you did not have these before. You did not have this, right? At that time, internet was going on the website and having a dial-up tone and all that. Now you have it on everyone's screen. Even your security guard is watching that. So it's very important for you to market yourself. How much you need to spend depends upon your comfort. You can't put a number to it, but what I see is that it should be about 10% of how much you want to earn. So I think that's how you should think of marketing. That if you want to earn, suppose you want to earn 4 lakhs a month, you want to put that much in marketing, and make sure that, since that may be a little smaller in amount, make sure that you're choosing the right platforms to do it. So probably you may need to choose platforms which everyone will have access to, like Google or Instagram, and then if you feel that no, you can do more, then probably you need to keep reassessing yourself and seeing whether I can keep increasing it or not, or whether I need to tweak something there. So I think 10% of what you think your revenue should be is what you should.
Understood. So the previous question that I asked about the capital investment for your clinic, right? One follow-up question from the plastic surgeon community is, what are some of the key hires that we have to make when we're setting up a clinic?
Yeah. So the most important person to hire is your manager.
Mhm.
And the qualification does not matter. But remember, one thing is that your people working for you are only going to represent you and are going to speak like you. So you have to train them. He or she has to have the perfect, should have a good idea of what you do. And I think the most important part of for them is to be well spoken. They have to communicate well. and that is extremely important. So the first person you will hire is a manager, who is somebody you need to help grow with the clinic. And then after that, it's important to have qualified nurses. Whatever you do, make sure that they're qualified nurses, because even to put an IV line, yes, anybody can put it. But if you have a qualified nurse in your clinic, then you're legally clear. Plus, that nurse is actually trained in handling things. So, based on how your volumes increase, you can increase the number of nurses. So, the first would be a good manager, and the second would be a nurse. It can be a BSc nurse, it can be anything.
Thanks for sharing. I think now I also have a bit more understanding. So we are at the end. Thanks for coming up on the Medifluence Show. Love talking to you.
Thank you so much. It's a pleasure.